I'm Cheryl Fisher, the Specialty Co-Director for Informatics out of the School of Nursing. My doctorate's in technology and education as combined specialty, and we were noticing that with all of the AI coming into the educational arena, that there was not a lot of faculty training for artificial intelligence and how it was being incorporated into education. So we identified a gap. We had a small group that sort of a brainstorming meeting of how are we going to address this. So Dr. Stevens came up with the idea of focusing on pedagogy and productivity.
We have been training faculty to use a specific generative AI tool to create custom GPTs. These custom GPTs are basically personal assistants. You can think of them as that. There's so many examples: virtual teaching assistants, simulation generators, that kind of thing.
The idea of the program was to address faculty sort of with a two-pronged approach, give them some skills, and then to have them teach a colleague and to give them lots of resources, at least as much as we could, to help them in those two areas of pedagogy and productivity.
So we designed this as a two-cohort kind of program, and each cohort meets with us twice. And in those workshops, we teach them the skills needed to use generative AI.
With the grant, we were able to purchase licenses for the faculty to have access to a premium version of ChatGPT. And within the ChatGPT environment, they were able to create custom GPTs. And a lot of them were very focused on developing a syllabi, developing learning activities, customizing activities, learning activities, and aligning activities with objectives or developing objectives themselves within their courses. So we also have a lot of people working in simulations, so they wanted to learn how to create cases. We've heard from the faculty how much time it takes them to do this work, and so not only does it give them additional ideas, but it also helps to create some of the content and save them tremendous amounts of time.
So it's almost like hiring somebody to be your assistant, except the custom GPT doesn't require to be paid, right? And it doesn't sleep, so they're ready to go whenever you need them.
The response to the training was very positive. We had a lot of faculty that were very excited about the new skills that they were learning. They were excited about the possibilities of what they could do with the custom GPT environment, as well as the ideas that they had to help facilitate their work in terms of productivity and their course development and working with their students.
One comment in particular that I received from faculty in the program was how their students are using the tools now. And specifically, I think the tools enable students to ask questions, maybe that they were afraid to ask their instructor. So it's really engaging students in a different way, and the faculty are very excited about that.
So we're looking to write other grants. We have submitted several for some of the virtual teaching assistants and for the faculty workshop training, looking to MHEC in the state of Maryland to expand the training to larger audiences, to grow the program, get other people in from other universities and other schools of nursing, and then also to disseminate the work through publications and presentations.
I am really excited to see how this is going to change nursing education, nursing practice, and healthcare in general.
Some of the questions that we had at the School of Pharmacy and some of the needs that we encountered over the years is when students kind of encountered patients, real patients on rotation during their advanced pharmacy practice experiences or their API rotations that they have during their fourth year of pharmacy school, There was perhaps a gap that we identified in their clinical competency as it came to developing really consistent, comprehensive, patient-centered plans for patients, especially those that were a little bit more in tune to the patient's needs that we have in our current population in Baltimore. And so we wanted to identify ways to improve that clinical decision-making in a collaborative way, and also to see how we could improve the students' and the learners' ability to communicate those patient-centered sound plans to patients so that ultimately those plans could be executed and patient care was optimized. So we wanted to explore virtual patient simulation. We kind of had this vision that creating virtual patient avatars or pre-existing virtual technology could be a really great space to fill those gaps. And approaches in the therapeutics curriculum, in the classroom, ultimately, hopefully, would help to prepare students and improve their skill performance. And so our first step was conducting this extensive literature review. So far we've done that. We have a much better understanding of what seems to be worked, what's working, what's published, how it's being assessed. And what we found so far is that pretty consistent with our vision and the gaps and maybe filling that need, many other schools are finding that the complex skill development, that clinical decision-making, cultural sensitivity, communication skills can be improved through the use of virtual patient simulation. Using patient simulation can create more realistic scenarios in a low-stakes, low-pressure environment for students so they can better understand decision-making. So now that we've done this literature review and have a really sound understanding of approaches, how it's being assessed, all the technologies that are being used, we're currently attending future conferences with our seed grant money to better try out, explore these top technologies that have been shown to be really effective and that are being used. I think once we get a sense of the hands-on, trialing out, exploring the products that we envision to work, once we figure that out from a feasibility perspective, we'd really like to pilot the virtual patient simulation in a smaller pharmacy, elective course perhaps, but with a smaller group of pharmacy learners. It kind of is the perfect timing because our curriculum at the School of Pharmacy is evolving and we're moving in the next year to a competency-based curriculum, which I think this type of simulation technology will really lend towards those types of learning styles and help to reduce cognitive load and really just focus on competency. And so we're really excited.
One of the big challenges in restorative dentists is the teaching of dental bonding. So currently we have this technique being taught by using plastic teeth. So in this way, we don't have much opportunity to give students feedback and how the bond procedure was properly done. I will give you an example. The bonding we're gonna have technical steps of etching and apply the adhesives, okay? And with the plastic tooth, we don't have much to say if this was properly done or not. So what we were looking is to reduce or eliminate this learning gap by providing a technical training that can give a real-time feedback for the students. With the funds, we have the opportunity to acquire 5 bonding tester machines, as well support the implementation this in our in the practical part of our course in our clinical rotations. So for 2024, we have the first contact. The students have the first participation. And we have already very exciting results. So looking forward for great opportunities with that. So we are looking for first initially to establish the feedback criteria, how does do and what will be the number and this criteria in terms what would be good and what should be revised. And then we are at the same time we are collect information, qualitative information from the student regarding their perception of this new training versus the plastic tooth, so we can have a better idea how much improvement we are bringing to this course. So we have 16 students rotating through this activity, which allowed them to working with the machines, do several times the procedure and feedback, and that is very interesting. They become competitive. So my bond is gonna be pretty good. My numbers will be high versus other colleagues. So it's been very positive in this aspect. They are very much right away attentive to details, versus difficult to see that excitement in the plastic tooth. So very, very exciting results.
I'm the managing director of the Intellectual Property Law Program and the Business Law Program. I help the program in bringing opportunities to the students. It's often a case where students will learn the theory, but they always don't get that hands-on experience and apply what they've learned. So what we wanted to do was bring an opportunity to specifically the intellectual property law students who don't get the opportunities to participate in moot court competitions or moot court or trial team. So we thought bringing a course that was simulating an administrative hearing course would be a great opportunity for them. First, we started off with finding instructors for the course, and that was a task because we wanted to bring in experts. And so Janet Gongola and Jeffrey Abrams, who are administrative judges who sit on the PTAB, were kind enough to come and instruct our course. Next, they decided how to create the curriculum with some assistance from the administration at the school and came up with a boot camp type course. It lasted over a week, and it was an immersive experience. So during the course, the students would go through a case study, and they started from the beginning looking at the type of case that would come before the PTAB. They went through it with the judges, and they then moved through each phase of the case. They had to discuss the use of depositions, the use of experts, because on the PTAB, they usually don't have live witnesses, which is really different than other courts. So they focused on the different stages of a case that would be in front of the PTAB, going up to oral argument, and they actually got to watch a live argument. From the feedback that we got, I spoke with a number of the students as well as we did a post-course survey. The data was universally positive. The students really enjoyed the instructors. They found them to be the experts that we thought they were, and they also enjoyed the material. Even students who were not patent-oriented, they thought that it was really valuable. The experience of being able to go through the phases of an administrative hearing is very different than going through the phases of a trial court, and so we were able to bring them that unique opportunity. I think what this course has shown is that experiential learning is really valuable for students, and we need to bring as many opportunities to them as possible. The how-to practice law is not always available in the classroom, and so anytime that we can bring a application of what they've learned or an opportunity to develop the skills or better their skills is always going to be beneficial, valuable, and appreciated by the students.
I was really excited when I saw the LEAPS educational seed funding. I noticed there was a gap in pediatric residents having a comfort around reproductive health care, particularly counseling for folks who are LGBTQ and those of the trans identity. And so my particular proposal was around creating an educational curriculum with standardized patients to increase that comfort and that knowledge and to enhance language use. Making residents more comfortable using the specific language that they might have to use when encountering folks in real time. So we've been implementing the curriculum since the beginning of the year. This was a curriculum that we really wanted to start in July with our recently incoming intern class. And so we've actually been able to have every block or every month of residents participate with that. And so about 1 to 2 residents participate every month in a standardized patient scenario that happens actually in our clinic. And they get to, it's about an hour long, an opportunity to meet the patient, do a reproductive health counseling visit, do a physical exam or a GYN exam with a GYN model that we were able to purchase through this seed funding, and then counsel the patient based off of what they encounter in that GYN exam, and then do a debrief scenario with either a nurse or a social worker on the language use that they have, as well as the standardized patient. And so we've had really great feedback. Our residents actually have asked for more and more scenarios. And so we're building out more standardized patient scenarios, both based off of the physical exam that we purchased through this funding, as well as language use, and which is independent of the funding. And so we'll be doing more, we'll be building out more scenarios and incorporating them not only into our residency program, but hopefully doing it as part of our clerkships. I found that this grant was extremely accessible. It was a great opportunity to build a small project that needed a little bit of funding to make it more well-rounded and push the comfort of our residents a little bit further, so that we could get really good data. And I'm looking forward to using that data to push a little bit further.
The need that I was trying to address in the LEAPS proposal was creating an opportunity for the graduate school to link with the UMB strategic plan, the UMB sort of values with equity and justice, professional development, cultivating and creating a welcome and inclusive environment for students, for everybody within UMB. So I created this project. I called it CARES, and it was an acronym for Cultivating an Anti-Racist Ethos for the graduate school, utilizing a social justice syllabus design tool. And so the social justice syllabus design tool was created by Dr. Taylor over at San Francisco University, and was a tool that could be used to help guide faculty in creating a syllabus, being very, very intentional around framing social justice in their course. So I saw that there was an opportunity to attend a workshop by Dr. Taylor at NCORE, the National Conference on Race and Ethnicity, NCORE, and that was last year, and she was given a workshop on how to engage faculty and develop social justice within your pedagogy. And so I was able to use the funds to travel, and so NCORE was in Louisiana, and so this gave me an opportunity to attend the workshop and to learn directly from her and get tools that I can then bring back to the graduate school. And so a natural next step is, once you have done the work and created this environment, or you've done your best to create this environment, is to ask your students, how did we do? How did I do? What are some opportunities for improvement? So I think next steps is just being mindful of how we are looking at how students are going to be evaluating. What's some feedback we could give to faculty on, how we can take feedback, how we can improve. What are some other reflective practices we can do? Also working with the FCTL on templates for syllabi. And are there opportunities to not so much mandate, but strongly suggest that faculty perhaps include some of these other components in their syllabi? And if it's standard, then students will see that this is just who we are.
The educational need that really prompted our proposal for the grant that we received was based on feedback from the medical students who did do the transition to residency course with us. We are only in our 3rd year of doing the course, so it's relatively new. And based on some of the feedback that we got from students, they had hoped to do a little bit more hands-on training, a little bit more skills and procedure type of instruction. And so in order to make that happen for them, we had applied for the grant to help us, purchase and fund some of that portion of the course. Our proposal included money for things like suturing equipment, things for doing lumbar punctures, We were able to get IV insertion kits and get infant-sized arms and legs, which are not always readily available for us through our simulation centers. So we thought it could be nice to have some just for our course and for the students. And then we were also able to get some larger technology, like a new screen to help with various games that we were planning on doing with them and to implement that flipped classroom model. In terms of where we are right now in the project, we have ordered all of our equipment, and so some of it has started arriving, so we're excited to unbox that, and our course will be implemented again in April, so we will see sort of how all of these new sessions go. We have some new faculty members who are running a lot of those sessions, so we're really excited to get that started. And definitely through this process have learned a lot about kind of what technology is out there in terms of implementing this type of a flipped classroom model for students, and really understanding what that feedback was from students and how to best kind of implement that in our course this year. We really hope that this year the students can give us even more feedback on sort of how they felt about all of these new sessions that we've implemented. Did they feel that those skills that they gained through the sessions were helpful? And then we also want to see, once they start their residency training, after a month or two into their new residency, did they find that the training that they received during the course was helpful? And were the skills that they learned in terms of the procedural skills and some of the simulations that we'll do, was that helpful for them as they transitioned into their new role as residents? So that's definitely part of it. And then the next part that we're hoping to sort of transition some of this into is our third-year medical students and also our residents. So can we, expand our group of learners that use some of this technology to see if we can kind of improve skills all throughout the pediatric training here? I think it's really important to think about how we bring that empirical mindset into our practice as educators and as we implement new curriculums to understand, is what we're teaching and how we're teaching it effective for the learners that are in front of us? And we know not all types of curriculum will work for different types of educational materials. So understanding that in order to know is something working or not, we need to study it and look at it from that mindset. So I think it's really important, especially for any new curriculum development, to think about what learner is in front of us and getting feedback on the curriculum that you're putting in to make sure that you're optimizing the way that you're teaching it.
Hello there, thanks for listening. Today we're talking to Dr. Isadora Garcia in the dental school about using 3D printing to solve a clinical simulation challenge. Dr. Garcia was a recipient of a LEAPS Educational Innovation Seed Grant in 2025, and this is an update on her progress. I thought we could start by having you tell us a little bit about yourself. How did you come to be a dental educator?
So I completed the DDS, so the dentistry course in Brazil. And after I completed this course, I did my master's, the PhD, and the postdoc, also in Brazil. But part of my PhD was here in the University of Maryland, Baltimore, from 2018 to 2020. And when I finished the PhD in 2022, we had a position open in the division of operative dentistry here in the School of Dentistry. And I applied to be a faculty in that year. So I was already doing the postdoc when I was selected for the interview process and for the faculty position here. And then I came from Brazil to the USA in 2023 to be a faculty here. But since when I was a dental student, I already knew that I wanted to be a professor and a researcher. I was just figuring it out where I would go after the PhD, but I already knew that I wanted to be a faculty.
So teaching was always part of the plan.
Yes, teaching was always part of my plan.
That's awesome. Well, why don't you tell me a little bit about your teaching? What courses do you teach? And tell us a little bit about your students.
So I am a professor in the division of cardiology and operative dentistry in the Department of Comprehensive Dentistry in the School of Dentistry here in the University of Maryland. And I teach the pre-doc students from the first to the last year. So I am with them in the simulation lab of operative ergonomics, dental anatomy, and then I am the course director in the second year in operative. But I am also with them in the third and fourth year for some lectures and for the clinics. So it's very nice because I can see them from the first week in the dental school until their graduation. And I am with them literally from the simulation lab to the last day of clinic. So it's very nice to see their path.
Yeah, so in addition to knowing those students very well, you must have a really good sense of where students are struggling at different points along the curriculum. Is that accurate?
Yes, 100%. I think that I am a faculty here for 3 years already. And in this short time, I could already observe like what they struggle sometimes in the clinic that we could, for instance, do during the simulation labs to make their life easier and a better uh, treatment for the patients later in the clinic. So yes, I can see how they go over time.
Yeah, that perspective must really help as you think about those educational interventions.
Yes, and we can modify lectures in the first years is to make this content appropriate exactly for what they struggle later in the clinic. So it's very nice to have the opportunity of observing them over time. This for sure. I think it makes a lot of difference compared to just being able to see them at the end. You know what I mean?
Yeah. And it seems to me that this perspective is what prompted you to apply for one of the LEAPS seed grants. So do you want to tell us a little bit about the educational need that you were noticing and what you were hoping to do to address it?
Yes, this was exactly the reason why we applied for this grant opportunity. So the main educational need came from a very common gap that we see in dental education. That is the fact that students are trained using highly idealized plastic teeth, but they are then expected to treat real patients with very complex and progressive caries lesions. So here sometimes we call cavities, right? So I'm gonna talk here about caries lesion, talking about these cavities. So in preclinical training or in the simulation labs, as we call, most models that we use, they represent caries as a single or very static defect in the tooth. And they do not reflect how caries actually progress through enamel and dentin, nor do they provide realistic tactile feedback during excavation. So when the students are removing this tissue that had caries. So as a result, students often struggle when they transition to the clinic, especially with caries detection, clinical decision making, and determining how much infected tissue should be removed. So we realized that students were technically learning procedures, but not truly developing so well this clinical judgment, particularly when it comes to the critical question of where should I stop when I am drilling or removing this tissue that has caries? So this highlighted a clear need for teaching tools that can simulate different stages of caries progression and better mimic the feel and behavior of real tooth structure. So this project was created to address this gap by providing multi-stage caries models that help students practice diagnosis, treatment planning, and the caries removal in a way that is closer to a real clinical condition. So the goal is to better prepare the students for patient care and to increase their confidence before they enter the clinic.
Mm. That's so interesting. So it sounds as though, I think sometimes in sports analogies, it sounds as though the equipment that you're using in the practice round while the students are in simulation is not going to give them the same sensations or the same, like you said, the tactile experience as what they're going to be using in the game, which would be the actual patient. Was that the challenge, so that the feel becomes very different when they're interacting with the patient?
Exactly. So nowadays, we have a different dentistry. So we work with minimally invasive dentistry. And when we have a very deep lesion of caries, we do not remove anymore the entire. Of course, we have many whys and how to do that, but basically talking, we do not remove all the caries tissue that is very deep, like over the pulp, we call. So we leave a specific type of dental hard tissue that has caries on the bottom of this cavity to help protect a little bit more this tooth. However, when the students are learning and doing that in the simulation lab, they have an entire body of caries that is exactly the same. And in the clinic, we remove a very, very soft dentin and we keep in the bottom part of dentin that is a little bit more firm. And this little bit, like where should I stop? This is very difficult for them to understand up to where they should go. So we wanted to make the simulation lab even closer to the clinic.
So tell us about what you did. What was your idea to help solve this challenge?
Yeah, so we created this project, so we called it Simu Caries, and this is the idea basically, or how we also use the funds with this grant. We purchased a dual extrusion filaments 3D printer, and this printer allows us to extrude up to 2 filaments simultaneously and to combine up to 9 different filaments or 9 different polymers within a single printed model. So this ability was essential for our project because it allows us to simulate the different layers of the tooth and the many different stages of caries progression within the same tooth. So these materials allowed us to create and test early prototypes needed to produce the initial caries models. And I think basically is we bought a 3D printer that we can use different polymers at the same time to create this difference in caries tissue inside one single tooth.
Yeah, that's amazing. So how is it going? Have you been able to actually create one of these models? Have you figured out the right kind of polymers? Where are you in the process?
So the project is progressing well, and we are currently in the phase of developing the ideal model. So creating different textures using all these filaments base for the 3D printing is a little bit more complex than it might seem because it requires not only changing the type of polymer, but also adjusting the printing parameters, especially the printing speed and the temperature, because this is going to increase the porosity of this polymer and is going to decrease the density of some specific layers. So imagine that one lesion of caries, we want to create at least 3 different tactile sensations. So we need to change the velocity and the temperature that the filament is being used for us to have these different of textures. So it's a little bit tricky, but it's going well. We are creating the final model now. And I think this process has taken longer than we initially expected, but it has been extremely interesting and rewarding. We are already producing teeth with clearly different tactile perceptions, which is exactly what we were aiming at the beginning. And another very positive aspect of the project has been the student involvement. So 2 third-year dental students began working with me on this project last year. And one of them presented the project at the American Association of Women Dentists meeting last year. And it was very nice. The idea was very well received by the professors of other institutions. It generated a lot of good conversation. And both students are enrolled now in an elective course called Research with a Mentor at the dental school with me. And they have been very, very important to help me with all these tests and 3D printing and model development.
That is so exciting. So you have students serving with you as kind of co-investigators. It sounds like a very experimental process, trying different ratios, different printing speeds. It sounds like a lot of trial and error to get this exactly the way you want.
Yeah, we bought some different filaments because we talked with the manufacturers and they explained to us what would be the hardness and what to expect about porosity of each one of them. But even having different filaments, different polymers from the beginning, we also need to do all these small changes in the speed and in the temperature that these filaments are being printed. So it's very like test, okay, didn't work, go again, change a little bit. So the students are helping a lot to do these small and very important modifications.
Yeah. Oh, that's exciting. Do you have a sense of when you might be able to have students working with these models?
Yes, we believe that in the class that is going to start in August, we are going to have already different teeth with different perceptions, like tactile perceptions. And we are going to have already one single tooth with all these different layers. So they are going to be able to remove, for instance, the first layer of caries and see, wow, this is very, very soft. And then they go deeper, deeper, deeper. It's going to start to be a little bit firmer. So they're going to have all this difference in one single tooth. Probably all of these is going to be able to have in August for the next class.
I can't wait to hear how it goes. And I'm also curious what your vision is now that you're close to having this prototype, you're close to having students working with it as kind of the pilot group. Where would you like to see this go?
So the next step will be to formally assess the students' tactile perception when working with these different models. And we plan to apply a survey and structured evaluations to understand how students perceive the different textures when using different dental instruments, specifically a spoon excavator, which is a manual instrument that we use in the clinic, and a bird, which is a mechanical or a rotary instrument. So you can work with both, and we want to evaluate how the students are going to feel using these both instruments in these models. And after that stage, we will begin to further combine and do all these different layers with different textures within the same cavity. So all of these we expect to do with this class that's going to start in August. So we will likely start with two distinct textures in a single lesion, but then progressively add more layers with more different tactile properties to better represent the clinical reality of caries progression. But what has been most interesting to me now, I think, is not only the goal of creating the tooth that looks and feels as close as possible to a real caries tooth, but also the educational impact of exposing students to these layered models early in the training. When the students repeatedly work with teeth that have these different layers and tactile responses, I believe that they are going to gradually internalize the concept of minimally invasive dentistry, and they're going to start to place greater value to on tissue or dental hard tissue preservation. And this is something that we really want to achieve in dentistry in the entire planet along the time.
Yeah. So it makes that concept much more real early on in their training.
Exactly.
And that sounds like that's meeting the goals of the field in terms of patient outcomes and patient experience. So this is just an incredible project, Isadora. I'm so glad you shared it with us today.
My pleasure. I really believe that maybe this can have a meaningful long-term, impact on their clinical decision making, for instance, like encouraging selective caries removal instead of complete caries removal in deep lesions, which nowadays we know that it leads to better outcomes for patients. So
Yeah. Oh gosh, I bet other schools are going to be interested in this as well, and I can't wait to hear how this evolves over time. Congratulations.
Thank you. Thank you so much for the opportunity.